with vaccines now rolling out. Um, COVID-19 has been a kind of a seminal event in many of our lives. Many people have lost their loved ones. In Canada, we have experienced about 500,000 deaths, half a million cases and about 14,000 deaths due to COVID-19. MDI International is an organization whose mission is to identify, mobilize, and advance all possible resources to enhance a healthcare provider's potential to provide care, increase physical and mental health, and to deliver emergency relief and health development aid where needed. The organization is based in Calgary and continues to serve local and global communities. We will be presenting today's webinar on COVID-19 vaccines, and we'll discuss the myths, the mysteries, and the facts. My name is Imran Mirza. I am a clinical professor at University of Calgary. I'm a pathologist and a physician. The other panel members are Dr. Naveed Sayed, who is a renowned and esteemed scientist at University of Calgary. He's a neuroscientist, and his work is recognized all over the world. And we also have our own public health expert, Dr. Mohammed Imran, who has a master's in public health from Harvard School of Public Health, as well as significant experience in this field working with Save the Children organization. I would also like to say in the beginning of our presentation that the views expressed by the panel members are their own and should not be attributed to the organizations of their employment. So the views expressed are the learned opinions of the panelists and the evidence that they have gathered over time. And the panelists declare no conflict of interest related to vaccines and other products discussed in this webinar. So we have no financial conflict in this during this presentation. With the vaccines now available, there are a number of questions already out there. Who's going to get it? Is it safe? Is it effective? And there are also all kinds of myths out there, whether this is a way to transmit or track people or transmit some other infections or to test new modes of therapies. I'll pass on the question to Dr. Naveed Sayed first in terms of what are these vaccines and what do we know about the virus that has allowed us to so rapidly develop a vaccine in less than a year for a disease that nobody had heard of a year before?
Thank you, Dr. Rahman. Can you see my slides?
Yes.
Thank you. And also really like to thank Dr. Mohammed Imran and the MDI team for the opportunity. And I think it's a really wonderful time for us to be able to kind of do an inventory of different questions that are being raised. And it's a critical time point. And Dr. Imran pointed out, we are actually looking at some light at the other side of the tunnel. But for some people, it appears that light might be another train. So I think what we need to be able to do is to actually put those myths to rest and then also put everybody's mind to ease so that you can enjoy these wonderful holidays with family and the family members. So as you know that around about this time last year, China declared that it has an interesting virus which spreads like a wildfire, and that within few days the virus actually spread from a market in Wuhan, that's what people believe, to many parts of the huge large city, and then also into other neighboring countries as well. So what we know about this particular virus is that it comes from a bat. And that's a fact. And you know that bat has an incredible immune system in which for this virus to survive for several millions of years, it has developed a strategy to survive and mutate and modulate itself to fend off all the attacks that maybe the bat will throw at it. And so it's really interesting in a sense that also when a bat takes a flight, its body temperature goes up to 40 plus degrees. This particular virus has adapted to survive in that hot environment that most other bacteria or viruses do not thrive very well. And this is one of the reasons that our body raises its body temperature to make the environment inhospitable for these attackers that attack our body. So the fact is that it actually came from bat, but it could not have been engineered in a lab, which is a myth. Most people think that somebody actually created this virus and it set it off. As I said, it took really millions and millions of years for it to become what it became in the end. Now, how did it come about? That's a mystery that we still don't know, but it could be related to somehow bat being part of our, kitchen for some people. So the take-home really message is to stay away from these bats and these animals. Don't try to eat them or consume everything that moves. Now, how did this virus become so nasty? So, these viruses are really RNAs. And some people don't even consider them as living cells because they have no identity of their own. So these viruses are basically RNA. They carry the DNA or the genetic material of any other cells or any part of the other organisms that they come about. Normally what happens is that any organisms or any pathogen or anything that attacks us would have two properties. One is the antigenicity, meaning that whenever it enters our body, it will stimulate the production of antibodies in our body to be able to fend off this particular intruder that has come into our body. The other ability that it has is that it's the pathogenicity, meaning that whenever it enters our body, it will make us sick. It will be a pathogenic factor and it will make us really ill and also cause damage to our body in different parts of things. Normally when this happens is what we do is that the scientist will try to neutralize these particular organisms and germs, viruses, by clipping off the areas where the pathogenicity lies. So in case of COVID-19, the actual spikes that this virus has developed, these are 12 spikes with spike proteins. They are like anchors that dig into our cells. And normally, I think our body's immune system, defense system would have recognized them. But what happens is that this virus has coated those spikes with carbohydrates, which is sugar molecules. And as a result, it actually avoids the radar of our immune system, and then it just goes below the radar system, and it digs itself into our epithelial cells, be that in spleen, in our gut, or in our lungs primarily. So these spikes are really the ones that cause most of the damage, and they are the actual spear or the gun or the bullet or the nasty part of this virus. So normally what we would have done is that we would have taken these clips, these legs off either through heat inactivation or enzymatic treatment to render it dysfunctional and then generate a vaccine from this. But they will be the live vaccines. For example, these vaccines could take many years, sometime up to 5 to 6 years. They are also risky for those people who have compromised immune system. But then came a novel technology, which is really RNA-based vaccine. And this has never been done before. This is the first time that all the scientists in the entire world has come together to generate this vaccine, which is really based primarily on the RNA. So we don't really use a particular conventional method. So what happens here is that we take the part of the viral messenger RNA that creates those spike proteins. We will then synthetically they create that genetic code. That genetic code, in a sense that it will be then, basically containing those pathogenic parts of the virus that are making us sick. And then the second step is because these messenger RNAs cannot survive on their own, that's why we are recommended hand washing extensively, because it has a very thin lipid coating. Just like an egg would have a thin underneath the shell, a very thin lining. And so they recapitulate this by coating this particular virus with some, fatty material, which is then injected into the human body. And this tricks our cells to produce those spikes only that the immune system can recognize. And once the immune system can recognize, it has the time to be able to kind of put together a defensive mechanism. And when that defensive mechanism is inactivated, any subsequent attacks by this virus could be neutralized. So this is really a very unique technique, and it's a lot of credit is gone to many recent companies, but the most important thing to remember is that actually it was a Katalin Karikó. It's since 1990, and she's a Hungarian scientist. And when she proposed the idea that mRNA vaccines could be generated, not only for these viruses, but also to tackle cancer, she lost her job in Hungary. She came to Philadelphia. When she proposed this, she was also fired from there as well. So you can tell that the radical ideas sometimes that we overlook comes and enhance us. So there were a total of 150 different companies. They went, on the go attack to develop vaccines. But the 3 or 4 companies that are really the leader in this out of 30, they develop, a RNA-based vaccine. So Moderna and AstraZeneca, which is coming from University of Oxford, then Pfizer and BioNTech, and this is also a German company, and then Johnson & Johnson, and many of these companies have actually generated, vaccine. And good for Canada, we have ordered vaccines from all of these, and when it's all said and done, we will have more vaccine than we really need, and that will give us the opportunity to provide vaccines to other countries that do not have the vaccines or the ability to purchase them. So this also looks really good on Canada from that perspective. So when this vaccine is actually, another way to look at it is that SARS, which is these COVID coronaviruses, because of the crown it has, they take the mRNA portion that encodes for these spike proteins. And then mRNA is made with instructions to, of course, to produce viral proteins. These are then injected into our body. Then our body will mount a defense. We actually have an immune response that could really neutralize these vaccines. So these vaccines, of course, being tested clinically because of the fast tracking of the whole process, they did not compromise safety, and they really very, very stringent rules and regulations are around these vaccines to make sure that they are safe. But there are many factors that we don't know the answers to because it was done in such a fast rate. So what did the clinical trial not tell us? So they used 47,000 people, and they found that 95% of them that they were injected with this vaccine and given 2 doses 20 days apart were actually 95% protected from any coronavirus infection. So the severity of the symptoms, really, which is a key secondary endpoint, was not really tested. So people how sick they get in the end was not tested. Similarly, hospitalization. Why is it important? Because too many would have died waiting for such trials without the healthcare interventions. So this was also not part of these clinical trials. And they were also not designed to test the transmission. So the people who have been given vaccine, were they also transmitting it, or were prevented for any subsequent attack? We don't know the answers to that. Now, will it save life? So that is really the first order criteria that vaccine in the FDA and many agencies look for. We do not know this yet. The infected would need to be swabbed twice a week for a very long time period, which is really not possible. And also, we would have actually had to have close to 400,000 to 500,000 people instead of just 42 or 47,000, and it would have cost us anywhere 500 million to $1 billion. So there were certain things that we don't know yet. As in terms of side effects, we normally do not consider. There were only 2 people who reacted to it, but they already had an autoimmune disease, or they have, they were also on anaphylactic medication as well. They were really affected. But we also know that these viruses, for example, in 1955, polio drive, it caused, some neuromuscular dysfunction, and also, the Guillain-Barré syndrome. And in 1975, influenza Y vaccine also caused in many people, narcolepsy-like symptoms. So, we don't know whether these vaccines, when they are used at such a large number, would have any impact. But, for the safety, they are safe to really use. Another important question that people ask is, does COVID-19 mutate? The answer is yes. Like any other virus, it will mutate. Our cold flu viruses mutate. How would we know that it has mutated? Actually, the swab testing will confirm, because it is designed to test a larger portion of the mRNA sequences. The vaccine also will be affected against those mutant variants and the viral. And the other important thing that people ask, and it's the myth, that this viral RNA may enter into our normal cell and change their function to do different kinds of things. That is also a myth that we would like to burst. These RNAs, they are very short life. They enter the muscle where they are injected. They coax the muscle to produce these, the vaccine will coax the muscle to produce those spikes. These spikes are then recognized by our immune cells. They will come and immediately recognize them and neutralize them. But then the virus is destroyed right away. It cannot survive more than 48 to 72 hours. It will never penetrate the nucleus of any cell. So from that perspective, it doesn't really affect it at all. So I will, at the end, maybe come to these, various technologies, or this myth that is prevailing all across the world, especially in our countries, whether these vaccines are meant to do really harm in the longer run. But for the interest and sake of time, I would like to really have Dr. Imran take over, and maybe we could come back to it if there is time.
So thank you, Dr. Naveed, for the explanation that you provided. We will come back to some of the things that you shared and ask more detailed questions about those. One thing that struck me from your presentation was, the rapidity of the development of these vaccines. In a year's time is just a testament to human ingenuity and creativity and collaboration that you referred to, that across the globe, the scientists were working together towards one common cause. And on the World Health Organization's website, there are about 140 different vaccine projects listed in almost every country that you can imagine. And of course, multiple vaccine projects in industrialized nations. You also presented some data in terms of what we don't know related to, I believe, Pfizer's vaccine, Pfizer BioNTech vaccine, in that slide. But I'll take a step back, and I would like to ask Dr. Mohammed Imran in terms of, what do we know about vaccines? I mean, we all probably got our shots when we were kids, for various other diseases. And to me, I think where it's related to public health, nothing else, nothing other than maybe sanitation has increased human life and decreased human morbidity than vaccines. It's estimated about 6 million people or lives are saved in every year because of vaccination. So Imran, would you kindly take us through the history of vaccines and especially how they are tested or developed? We learned that there are phase 3 trials going on right now for a number of vaccines, and the Pfizer data was published in the New England Journal of Medicine recently. So it'd be great if you could share with us your thoughts as a public health expert on the matter.
Thank you very much, Dr. Imran, and thanks a lot, Dr. Naveed. I think it was fantastic. So as Imran, you have said, I'll be just taking you through some of the public health side of COVID vaccine, and I'll be just I think most of my slides, they are just trying to kind of answer some of those very common public health questions that we get. Can you go to the slide, the first slide? Let's go back.
I'm trying. Sorry.
Oh, okay, no worries. So on this slide, I just wanted to share when we talk about the vaccine, so vaccines are something which are not new. So if you would see the development of vaccines, it started back in 1796. And till this date, if you kind of look at the number of vaccines, there would be more than 28 or 9 vaccines which are there, and they are globally available and they are being used. So this is something which is definitely not new. And we all know that as far as the vaccines are concerned, they are very important to save the human life. And Imran, you just mentioned if you look at data on the importance of some of these vaccines, we see that there are about 3 to 6 billion lives which are saved annually just because of these vaccines. So we can just give example of the polio vaccine, and the year in which this polio vaccine was introduced, it was seen that just in the very first year of the introduction of polio vaccine, the mortality from the polio, it just went to half. And right now we all know, for example, on polio, in most of the countries of the world, except a few, polio has been eradicated. I think vaccines are they are very important. And right now, since we all have been through this pandemic, the last 1 year, and everybody was looking forward to this time when we will have something or some kind of tool which can really prevent us from getting this virus. I think from that perspective and from the historical perspective, vaccines do play a very important role as far as the prevention of all these communicable diseases is concerned. So can you go to the next slide? So I think again a very important question, and I know Dr. Naveed alluded to this, that people have a lot of concerns on the duration that actually this COVID vaccine took in terms of in production. So normally when the vaccines are developed, they take around 8 to 10 years for the development. But in this case, we saw that all these efforts, they kind of started in the beginning of 2020. And now we are in December when we have a number of vaccines that have been approved. So I think there is no doubt that this process has been a rapid process, but I think there are various kind of explanations to this. And I think as Dr. Naveed kind of alluded on this thing, that the development process of the vaccine, it has not been compromised in any way. So the work actually on the COVID vaccine, it didn't start in 2020, at the start of 2020, I would say from the scratch, because we all know that, similar kind of viruses like, SARS-CoV-1 or MERS, they were already present. And a lot of research was kind of already happening. And then, when clinical trials, especially the phase 1 or 2 trials, again, a number of the vaccine producers, they kind of merged these phases. And then also in phase 3 trials, which involved a very large number of people into this trial, a number of steps were there which were being production by all these, vaccine producers simultaneously. Normally, when the development of the vaccine happen, and when we move from one phase to another phase, there is kind of like pause, and there are several kind of like steps like which are there, which probably in these cases they were shortened because they were like there were activities which were being done like simultaneously, especially I would say in terms of the production of vaccine, because right now when the data of the phase 3 trial it was shared, right at that time a very huge quantity of vaccines was already like under production. And then beyond that, like not only the vaccine production, approval process, and also like some of the processes which are related to the supply chain management, cold chain, all those activities, they were kind of like done in parallel. And all of these kind of activities, they enabled at global level that that we can have this vaccine as soon as possible, and it should be ready for the rollout. So I think we can't say this thing which is a kind of like very common myth that this process was done in kind of like in a hurry or in a hassle. So it was a shortened process, but then there were like very various kind of like explanations to this, which ultimately led to like very, I would say, quick kind of like availability of this vaccine. You go to the next slide, Imran. I just like included this slide because there has been a lot of discussion, like as far as literature on vaccines is concerned, and we all know like till this date, it is only this Pfizer BioNTech vaccine, which is BNT162, around which like the data has been published in the New England Journal of Medicine. There's a lot of like other kind of like literature which is available on other vaccines like AstraZeneca or on Moderna, but most of that is like the great literature. Good thing and the most important thing I think about this vaccine is that this literature shows that in the phase 3 clinical trials there were more than 43,000 participants who were kind of like enrolled in this like trial, with around 21,000 in the placebo arm and similarly around 21,000 in the arm who got actually the vaccine. And the results, like as Dr. Naveed has already like shared, and I think people know that as far as the efficacy of this vaccine, it came out of this trial is around 95%, and with a very kind of like mild to moderate, or I would say very mild kind of like side effects. Can you go to the next slide? I think on this slide, this also comes from the same study that has been published in the New England Journal of Medicine. So you would see on the right side that the good thing about this trial is like if we look at age groups on which like this vaccine has been tested, it starts from the age of 16 years and then it goes to the ages of above 75 years. Similarly, both males and females were included, and then with the various like racial and ethnic background, they were part of the study, and also from the various like origins in terms of like the countries from where they belong. And what we have seen, like as far as the results of this trial are concerned, that the efficacy across the ages or across the gender or across like these ethnicities, it is almost like above 90%, and even in some cases it's in the tune of like 100%. So there are definitely some age groups, like when we talk about those who are below 16, which were not part of this like study, and similarly there are certain other groups like which we will probably discuss during the question and answer session as well, which were not part of the study. But otherwise, like you would see that there was like a broad spectrum of like ages and other representation, which was definitely a part of the study. And I think one important point that also Dr. Naveed mentioned in his presentation was that in this clinical trial, endpoint was basically the symptoms and not itself infection. So on the left side, you would see like when we say that this vaccine was 95% efficacious. So we saw that symptomatic COVID-19 cases, there were only like either severe or symptomatic were 9 in the the vaccine arm against about 170 in the placebo arm. Can you go to the next slide, Imran? again, I will not go into the details, but I just wanted to share over here, that if, you look at the same, published data from this vaccine, you would see that, as far as the side effects of this particular vaccine are concerned, in these 21,000 people, were given this vaccine, were mostly kind of very mild, side effects. And some of them they were just kind of local events in terms of some swelling or redness or mild kind of pain at the injection site. And then there were some a little bit kind of at a later stage there were some side effects, but all of those side effects, they were very mild. And probably most of those side effects are because our immune system is obviously responding to the vaccine that those people get, and they were not a very serious nature. Next slide.
Imran, I will just interject here and say that Dr. Naveed also referred to the severe allergic reaction in a couple of cases in UK and one that has been reported in British Columbia. And I think it is related to the polyethylene glycol in this vaccine that some people can react to. So if severe allergic reactions are there, but they're very uncommon to this vaccine.
Yeah, Dr. Mann, I totally agree with you. I think the two, reactions which we have seen, we have heard, a lot about them, and we have seen that in the, newspaper as well. So they were kind of anaphylactoid kind of reaction, and most probably those people were already kind of their immune, they were immunologically probably compromised, and they have some history of allergies as well. So I think, out of these, clinical trials, at least the data that has been shared, it didn't show any kind of anaphylactoid reaction. But then, that is the reason why later on, this notification also came that people who have known allergies to the vaccine or any of the contents of the vaccine, they should not be given this vaccine.
And
yeah, go ahead, please.
Sorry, so this polyethylene glycol is commonly used in cosmetics and in other preparations like enemas and products. So I think people who could potentially be allergic would know that they are allergic to PEG in these products, and it is there in this vaccine.
Exactly. So I think that is why, we as a public health person, we always say that, if you have any known allergies to any of these products or otherwise, obviously you need to consult with your doctor, and, this vaccine is probably not recommended until and unless, there are special circumstances, but then, those cases need to be evaluated by, by the physician or by a health practitioner. So, I just wanted to show this slide because very often people ask, that how many, vaccines are there on the horizon. So this is a website, RAPS website, which is a Regulatory Affairs Professional Society. It has a real-time, update on the various, vaccines which are under development. And I just, looked at this website this morning, and to this date, I would say that there are almost 6 vaccines globally which have been approved, and you would see on the top is this BioNTech vaccine, followed by at least 2 or 3 other vaccines which have been approved in China and also in Russia as well. So if people, they want to get really an updated information on which vaccines have been approved or at what status of the approval they are, or in terms of literature, on the left side, you will see that, green mark. If you just click on that green mark, when you go to the website, you can get all the details and all the information on that particular vaccine. So I think it's a very useful site just to get, the details and the information on the various vaccines and at what stage of, development or approval they are. Can you go to the next slide? I think a very interesting slide, and this slide also has a lot to do, with the rapidity with which we have seen, the vaccines for the COVID, came out. So in this slide, you would just see, there was a lot of, investment that went into, the COVID vaccine development. I would say this is unprecedented, and you would see, that billions of dollars by the USG, by the Gavi and European funding were actually, injected into the development of this vaccine. And, probably this, I would say, is one of the key reasons why we have seen, that so rapidly this vaccine was developed in 2020. Can you go to the next slide?
That was the US government's Project Warp Speed, right? So, which was announced by the President
exactly.
Trump back in March, April.
Yeah. Not only like, US, but even the Gavi, the WHO, I think over this 2020, a lot of investment and efforts have gone into the vaccine development. So this is just again, the same thing. And I think Dr. Naveed also mentioned that the vaccine, this Pfizer BioNTech vaccine is an mRNA vaccine, which is a novel technology. But then beyond that, there are a number of other candidates and a number of other types of vaccines with the viral vector, DNA, or protein subunit, or inactivated viruses. They are also part of the horizon, and we would see the vaccines of many other types coming in future as well. Can you go to the next slide? I think this slide is important, and I just wanted to share because people very often ask us, being a public health professional, that what is the basis that this vaccine distribution has been kind of allocated, why the health professionals are getting it first, or why the people of the long term care facilities are getting the vaccines first. This is the slide actually which came from the CDC, which has established a group known as the ACIP. And this group basically looked at the three main elements in terms of the allocation of the vaccine. So first was the science, the second one was the implementation, and third is the ethics. So they looked at the COVID data globally from multiple countries into all of these kind of three major areas, I would say. And that actually led to the conclusion that which groups need to go first as far as the provision of these vaccines are concerned. If you go to the next slide, Imran, you would see when we talk about the phase one of the vaccine, in the phase one, we have these three phases, which is phase 1A followed by 1B and 1C. And in the phase 1A, there will be healthcare personnel or people from the long-term healthcare facilities, residents who would be getting this vaccine, followed by the essential workers, and then the adults, especially who are at more risk and they are above 65. So this is kind of a public health science that went behind this decision, which we are seeing globally, even including in Canada. When we have obviously this vaccine coming in, there is a working which has gone behind, I would say, the distribution of the vaccine into the various groups.
It will be interesting it's interesting to comment that from the immigrant community that in Canada, many of them are employed in the essential workers sector, right? So these community members are serving in food and agriculture, utilities, transportation, and so on. And also in these immigrant communities, people are living in multi-generational homes. And so are sort of an increased risk of transmitting the virus if God forbid they get sick. So it's understandable why they're listed there. And then of course adults with high risk conditions. And in Alberta, what I know is that the 3,000 to 4,000 vaccine doses that were initially received by Alberta Health, they were destined to go to intensivists in ICU, respiratory therapists, emergency medicine staff, and so on. Those who are at the front line of providing care, and people who you cannot actually can do without. So they need to be protected so that the care delivery can continue.
Dr. Mann, you are absolutely right. What I was trying to tell is behind all this decision, there was a rigorous working by the CDC and WHO, and that actually led to this kind of allocation. But you're absolutely right. Those who are at forefront, obviously their chances of contracting the virus are way more, and they need to be obviously protected because they are the backbone of the healthcare system. And it's just a couple of slides. I know they are a little bit busy, but I just wanted to show, because nowadays there's a lot of discussion on this issue of vaccine reluctance, or we call it vaccine hesitancy. But I think even in the US and both in Canada, and even the subsequent slide would also show this thing, that what we have seen in the recent maybe couple of months, that opinion of the people it's kind of changing. And now there is a growing number of people who are saying that once the vaccine becomes widely available, they will be getting this vaccine. Obviously, there is a huge number of people who are not comfortable, and they say that, that when don't want to go, first. But I think as, the time progresses and as, we get more and more clarity on some of the concerns that people have around, the COVID vaccine, these numbers, they would change. Can you go to the next slide? So again, I think globally and in Canada, in all, the provinces, a number of surveys have been done. So this one is a very recent one, which I just, saw yesterday in the National Post. And even in this survey, which was done in, Canada, it shows, the people that would say, now, yes, that they would get the vaccine as soon as possible. For example, from November to December, it grew from 40% to 48%. And then, on the right side, you would see, some of the most common, reasons that why people are kind of hesitant to getting, the vaccine, or they say that, they are the first ones to get the vaccine. Obviously, most of these issues are around, the side effects. And then, people say, as we have been discussing, last 30, 40 minutes, that this whole process was kind of rushed. Or there can be some long-term and short-term side effects as well. And sometimes people they don't have their trust on the politicians or the public health system. So these are kind of reasons. And I think in the coming days, we public health, people and scientists, you would have to literally play a very critical role in terms of kind of answering some of these questions and clarifying some of these myths and concerns which are there, so that people, they can get themselves mentally ready basically for these vaccine. Can you go to the next slide? I think that should be my last slide. Or
go ahead, and I'll let you finish with her.
Okay, so this is my last slide. I think it's just trying to portray what we are expecting in terms of the provision of vaccine in Canada. Obviously, we all know that this is something which is very fluid, because right now we have only one vaccine which has been approved in Canada by the Health Canada. But then, we are expecting that another vaccine like Moderna would be coming very soon. And probably in the first quarter of next year, we would have many other vaccines coming as well. So the things would change. But if we look at these numbers, we can say that as far as current status is concerned, there would be around 120K or a little bit more than 1% of the Canadian population which will be vaccinated this year, and then 8% in the first quarter, and around 50% in the second quarter, and around 100% in third and fourth quarters of 2021. But this is something which is obviously it will depend upon a number of factors, and if everything goes very smooth, and the vaccine deliveries and the supply chain and the cold chain and all those things, they work fantastic, then we can imagine a world that would be I would say very close to near normal, maybe towards the end of next year. But I think one thing is important, that as these numbers would grow, we would see some ease in terms of restrictions, and we all are kind of we all are having very high hopes that that each one of us definitely, when the turn comes in, will be getting this vaccine. I think that's it. So I've just tried to answer some of the common questions through these slides, but obviously now we can discuss as well. There are other concerns or questions.
In your previous slide, when you were talking about public opinion and trust in vaccines, we are living through the age of mistrust, mistrust in our institutions, in our politicians, in our systems and processes. And one of the, all kinds of myths that are there, or misinformation that is out there, is that the vaccines would be used to instill biochips or track people. Dr. Naveed, since you have created the neurochip, you are being implicated possibly that something to do with this. Could you just elaborate on what are these biochips, and if you could dispel this myth?
Sure thing. I think Dr. Mohammed Imran, he has provided really some interesting perspective in terms of I don't know if you can see my screen or not.
Not yet.
Okay, for some reason, I can't share. try to share. So I think, well, it is still uploading. Recently, I don't know if you have seen the, can you see it now?
Yes.
Yep.
Okay, so you just, I think, heard recently, maybe yesterday, New York Times had an article by where they quoted Sidney Powell, and then also, referring to Robert Kennedy, who is Junior Kennedy. He's also a senator, and they are all anti-vaxxers. And they said that if people will go to get the vaccine done for the first shot, they will be given a card. They thought that that card will be the tracker, and it will track them, and it will monitor them, and it will watch them. So those people who do not have this card, and actually this policy is also coming forward, that if you intentionally, for some reason, did not get vaccinated, your employee will have the authority to actually give you warning and then also sack you as well. But they thought that these kind of tags are there to tag people and to follow them and monitor them, and then also, observe them. So this was really one of the things. The other thing, the conspiracy, is that those people who got really, anaphylactic shocks, that it causes all kinds of other things. These vaccines have almost 160 different components to them. Some of them are mercury. Mercury is used to stabilize this, the vaccines for longer duration. They thought mercury causes autism, and if given to children, pregnant mothers, it could cause all kinds of problems. So those are actually something that one could discuss. But the things got really out of control with conspiracy theorists coming all together. And it was Dr. Dean Hammer who presented to National Institute of Health that people who are religious or have a religious orientation, they have this, what they call, monoamine vesicular transporter, which is kind of a, dopamine or serotonin, which is highly upregulated in people who have religious inclination. So the idea was that, could we go into these extremists or Muslims who are really religious, go in and take that gene out using a CRISPR technology, where we just go and snip this gene and make them civilized just like us. So that's when they thought, but how are we going to bell this cat? And then somebody suggested, but how about vaccine? We give them the vaccine. In that vaccine, what we could do is that we could actually use this radio frequency identifier, which is kind of a chip, which can contain the vaccine, but it can also contain, these CRISPR molecules that can go into these people and then knock out their God genes or their religious genes. And that was really the idea that floated. They said, well, how are we going to detect? So the idea was that you could really insert this little capsule in between your fingers, and then there are, radio frequency identifiers, just like you use your credit card now, tap onto the machine, and it allows you deducted, so money exchanged, bank money transferred. Similarly, the information could be transferred to detect people who are vaccinated and those who are not vaccinated. Or maybe this particular technology could be used. So the conspiracy theories really got even worse in our countries, that they're trying to make us, neutralize us, and make us non-religious, which is an absolute nonsense, in any cases. This is not an easy thing to do. And also, I think it will be really impossible for people to be able to trace someone with these. How are you going to implant these chips? How are you going to actually have the detector that could read it? So I think this will really deter, unfortunately, people from getting vaccines for one reason or the other. And I think if we did not reach the level of 75%, 70% vaccination status, we will not be able to control this because of so many other factors that are really lying around. So I think, we should dispel these kinds of conspiracy theories. And by the way, that was not my chip. I mean, my chip is a bit more sophisticated.
Thank you for that, Dr. Naveed. There are a number of questions in the question box here. I'll start posing them to any of you who would like to answer. First one is from Mohammed Shehbaz. He's asking, who sponsored vaccine studies?
So maybe Imran, I just I think showed one slide where you saw that, a lot of money was pitched into the vaccine development. Obviously, US is the biggest donor. And then there was also a lot of funding came from the Europe as well, and then from the Gavi as well. So I think it's not only one country, but multiple countries, including Canada as well. So they chipped in the development into the development of all these vaccines.
Another question from Asim Hussain is, would the vaccine prevent transmission of the virus?
Actually, scientifically, no, it will not. And we don't know the results yet because, when we do these PCR, and the PCR base, unfortunately, gives you yes or no answer, but it does not look at how many cycles you need to go through to be able to amplify that signal. So if you are really detecting it after 1 or 2 cycles, you know that you are A positive and also infectious as well. But if you're going to 30, 40 cycles, we don't know whether you're still infectious or whether these vaccine will be able to prevent this
transmission. Yeah. Another question from Asim Hussain is, would the life go back to normal as we knew it before COVID with the vaccines?
$1 million question. So everybody is trying that we get a life which is back to normal. So I think again, this is something which will not happen very quickly. Right now, for example, if you look at the Canadian population, our current number of infections stand at around, I think, 480 odd thousand, which is almost 1% of the Canadian population. And that means there is 99% population which is still kind of susceptible to this virus. And we know this phenomena of herd immunity is key. And for that, at least we should have, I would say, maybe 70 or 75% of the population who is immune, whether through the infection or through the vaccine. So until and unless we reach to those figures, can't say that life would be 100% back to normal. Then definitely we would see with as the vaccination rolls out and more people get vaccinated, numbers would go down, the infections would go down. Similarly, we expect that the hospitalization and the death and all those things, they will also go down. So that will help ease down life a little bit. So a lot of restrictions which we see at this day, they would be kind of eased down. But if we say that we would be 100% back to 2019, we don't have any answer, and we expect that maybe by the end of 2021, life look I would say close to normal, but not absolutely normal. Maybe Dr. Naveed, I don't know what's your point of view.
I think it's a great way to put it, but I would also include that in addition to this vaccine, we could need social vaccine as well. The social vaccination, not get infected, not infect other people. This will have to be maintained. But I think, will the life go back to normal? The world was going into becoming a global village. Globalization was really the major thing. Now, this particular pandemic has thrown everything out. It is now, we are going through deglobalization. We will go through deurbanization. People will really think about themselves first. So I think the economical impact of this will take maybe 5 to 10 years for us to really recoup. So I think health-wise, if 75% people are really vaccinated, we will develop herd immunity. That will probably get the life back to normal. But I think, we need to continue to be vigilant for another year and a half or 2.
Yeah, and I think I would also like to add, Imran, when we talk about, COVID, so, from the public health perspective, we always say that, we are working with a toolbox, so we already have, some of the tools in our toolbox, all these masks and, the social hygiene and, this distancing and then, hand washing. So all of those are in the tools. And now this vaccine is an added tool, which I think is the biggest kind of tool. I think Dr. Naveed is also trying to kind of I think he was trying to say this thing that, all other things, they're also equally important. And then I think the other thing is when we say that, will life go back to normal? I think we are, since right now we are in a global kind of village we all are living. So even if the life goes normal in maybe US or Canada or maybe some wealthy nations from Europe who would get this vaccine first, there would be many other countries in the world who would be struggling to get this vaccine, and they might be getting vaccine in 2022 or 23 or even 24. To travel to all those places, and it won't be 100% back to normal. And until and unless globally we see that the immunity with the vaccination or otherwise through the infection, it reaches to the tune of 70 or 75%. And we know right now the world population is around 6 to 7 billion. So it's a huge task when you say 70% of the population, which means 4 billion. If they're immune in the world, then you can enjoy a global herd immunity.
Yeah, and I think Bill and Melinda Gates Foundation is working towards getting vaccines to the third world countries as well. And I think there is a larger realization that it's not just the vaccination of people living in industrialized world, but also in other parts of the world. One of the questions being asked by Dr. Zahid Rafiq is, how long would people be protected by these vaccines?
So I think from what we have learned so far is that normally I think they say it's they guarantee up to 3 weeks, maybe up to 3 months. So this has really not been determined at the mass level. So I think the protection probably will be in that range, just like any flu viruses that we have. We take the flu, if the season is over, we are really back. But people are also getting reinfected at times. So that tells you that, the immunity doesn't last forever, for example, like the smallpox and other viruses.
True. As far as I know, about 3 shots of inactivated polio would protect you 100% for your life. 1 shot of measles would protect you for 96%. Immunity is there. We don't know too much about these vaccines. And now the phase 4 trial, which is the public use of these vaccines and then long-term monitoring of their side effects would be an ongoing process. A question from an attendee: is there a possible side effect of infertility with this vaccine?
I think again a very valid question, and I saw that this question in some of the newspapers. I don't think so. This is something which has been kind of tested. And one thing, obviously, we know that as far as the use of this vaccine in the pregnant women is concerned, so this has been not a part of this trial. So this is a vaccine which is not recommended for use in the pregnant mothers, because of maybe some side effects, or which we don't know, to be honest. So whether it will cause infertility or not, I think we don't have any answer to that question. But at least from the data that has been published, it doesn't indicate any such kind of relation with this vaccine. I don't know, maybe Dr. Naveed on the mRNA, if there has been any literature or past or something that can show this kind of answer to this question.
Well, these mRNAs don't really last for very long. So, but the association is made with interferon, which is often involved really in the production of sperms, or also, in the mechanism. So we don't really know whether it will impact in any which way, but, if people are getting reinfected, so I don't think that, one would anticipate any effect on that fertility in female or the male counterpart, but it remains to be determined.
One last question before we conclude, and this is related to children, that under 16 kids are not going to be vaccinated. How is this going to affect pandemic and children's health? Imran, would you like to speak to that?
Yeah, so as I shared with you, Imran, the data from the Pfizer BioNTech, vaccine. So the trial was on those who were above 16. So as far as the safety of this vaccine in under 60 years is concerned, that is something which is not being tested through this trial. But I just saw the literature. I think now the Pfizer BioNTech, they got from the FDA or whichever the regulatory body is, an approval to do some kind of studies in ages up to 14. I think as time passes, probably we will have more and more data on those who are below 16. And I also read somewhere probably the Chinese vaccine, they tested them in the young children as well. But again, that is the data that we have to see. But as far as we speak today about this Pfizer BioNTech vaccine, which is there in Canada, its role below 16, it has not been tested through these clinical trials. So obviously, this is something which will take time until and unless we have really credible data in those particular age groups.
And I would like to then conclude by asking you a very personal question to both of my fellow panelists. Would you take this vaccine if offered?
100%. 100%. As soon as it's available, and I think that's the kind of best message that anybody can give, especially coming from the public health background. As soon as the vaccine is available, we will be there.
Dr. Naveed?
I think I have my chip to determine whether. But absolutely, I don't think I will hesitate either, and I think even in instances when people take the first shot and they show reaction to any particular component within that vaccine, they will not be given the second shot. So they will be really taken off the list. And these are the recommendations coming from, the health agencies as well. So, but absolutely, I think, it's a lot better even for, peace of mind. I'm a neuroscientist, so I know that having that peace of mind at the least will be far more, I think, efficacious for me in terms of safety rather than really worrying about different things.
Thank you. I would like to thank both of my esteemed colleagues and panelists for this webinar. I would like to also thank MDI for giving us the opportunity to get together, discuss the recent developments and share what we know with the community. There are still a number of questions that are unanswered in the Q&A. I would imagine that in the weeks and months to come, we will find more and more answers to these questions that we have in our mind. And I think over time, we will be nudged by the evidence to take this vaccine and sort of help in stopping the pandemic. So with that, I would like to also thank Dr. Abdur Rahman and I think, sorry, I'm Zafar Yusuf, who has helped us at the technical level in getting this webinar through. It was broadcasted live on Facebook and on YouTube. And so thank you, Zafar, for your efforts. With that, I would adjourn, and until we meet again, stay safe, stay well, and get your shot.
Just one additional thing I would like to add, that these videos will be available on Facebook as well as on YouTube. And I know that there are lots of questions that are remaining. We will collect those questions and we'll send it to the panelists. And perhaps we will see if we can get the responses back, because I don't want to disappoint people who have been putting their questions in. So you're not going to be totally free, Dr. Imran and Dr. Naveed Syed and Dr. Mohammed Imran. So I think we will come back to you. So thank you very much, and we'll conclude.
Thanks everyone. Thanks, Dr. Naveed. Thanks, Imran. Thanks, Dr. Rahman. Take care. Bye-bye.